Chapter 12. Choosing a Theory. This video content is based on Introduction to Health Behavior Theory by Joanna Hayden. In this final chapter, we explore how to choose the right theory for a public health program or research initiative. Why choosing the right theory matters. Not all theories work for every situation. Some focus on individual motivation. Others explain peer influence, community dynamics, or policy change. The best theory is the one that matches the behavior, population, context, and goals. Theory gives us a roadmap, not just to understand behavior, but to change it. The theory essence sentence. The theory essence sentence for this chapter is: the best theory is the one that fits the health problem, population context, and goals. Theory is a tool, not a checklist. When to choose a theory. The right time to choose a theory is during the planning phase of your program. Use it when you are assessing needs, setting goals, designing messages, choosing evaluation methods. Theory helps define what behavior to target, what factors to influence, and how to measure success. Factors that influence theory selection. There are several key factors to consider when choosing a theory. First is the health issue or behavior. Are you addressing a personal decision, a social habit, or a systemic barrier? For example, using a condom is individual. Smoking bans are policy. Second is the population. Age, culture, literacy, and values matter. Teens might respond to peer modeling. Adults may value autonomy and self-efficacy. Third is the setting. Is the intervention happening in a school, clinic, workplace, or community? Different settings may require different levels of influence. Fourth is readiness to change. Is your audience unaware of the issue? Ready to act? Some theories help raise awareness. Others are better for guiding action and maintenance. Fifth is the program goal. Are you aiming for behavior change, education, or policy reform? The goal shapes the level of theory you'll need: individual, interpersonal, or multi-level. Fit and flexibility. There's no rule that says you must use only one theory. In fact, combining constructs from multiple theories often creates stronger programs. For example, use health belief model to understand risk perception. Add social cognitive theory to build self-efficacy. Layer on social ecological model to address environmental barriers. Just make sure your choices are intentional and based on fit, not convenience. Theory in real practice. Here's how theory informs real-world public health programs. During the needs assessment, theory helps frame questions. When designing messages, it identifies key beliefs to address. When developing interventions, it guides structure and strategy. For evaluation, it helps measure the right variables. A program on diabetes management might use health belief model for risk and benefits, trans-theoretical model for readiness to change, social capital theory for community support. Well-chosen theory helps programs move from random to strategic. Final thoughts. Theories are only useful if you understand them deeply enough to use them wisely. They should guide you, not limit you. Effective public health professionals ask, what's the behavior? Who is the audience? Where and how will the intervention happen? What barriers exist? What outcome do we want? Answering those questions will guide you to the right theory or combination of theories. Chapter summary. Choosing the right theory improves program design, delivery, and evaluation. Theory selection depends on behavior type, target population, setting, readiness to change, intended outcome. No theory fits all, but strategic use of theory leads to better health outcomes. This video content is based on Introduction to Health Behavior Theory by Joanna Hayden. Congratulations on completing the final chapter in this series on health behavior theory. We've explored the foundations, the frameworks, and the practical tools that guide how public health professionals understand, influence, and support behavior change. From self-efficacy to social networks, from individual decisions to policy-level shifts, this journey has shown that health behavior is complex, but never random. You now have a full toolkit of theories, each with its own strengths, each built on decades of research, and each ready to be adapted to your work, your community, and your cause. Remember, theories are not rigid, they're flexible. They are not one size fits all, they're strategic. And most importantly, they are only as powerful as the people who use them. Whether you're planning a health campaign, writing a grant, building an intervention, or just trying to make a difference, start with insight, lead with compassion, and ground your practice in theory. Thank you for joining me in this learning journey. Keep going, keep growing, and keep shaping a healthier world, one theory informed decision at a time.